Welcome, everyone. I know some folks are still hopping on, but for the sake of time, we'll go ahead and get started. So I will turn it over to our CEO, Kiana Thomason.
Thank you, Corey, so much. Good morning, everyone. Welcome to Health Forward Foundation's Healthy Communities 2021 Pre-Proposal Conference. I hope each of you and your loved ones are healthy and well as we traverse through this very challenging time in our community and in our country. It's a pleasure to share virtual space with you this morning. I see so many friends and familiar faces among you, so virtual hugs to many of you, as if we were in a conference room. That's what we would be doing right before we got started. So sending hugs and love to many of you who haven't seen all year. We always appreciate the opportunity to get to connect and get together with our partners, even more so under the reality of our current environment. So thank you for being here this morning. I am Kiana Thomason, President and CEO of Health Forward. And by way of introduction, just very briefly, I have spent the past 20 years in healthcare leadership across healthcare payment, healthcare delivery, health policy, and of course now rounding things out nicely with health philanthropy. Prior to coming to Health Forward, I spent 8 years at Blue Cross and Blue Shield of Kansas City, leading population health and community health solutions in our community in partnership with providers mostly, as well as community members. I also spent 8 years at Swope Health, one of our wonderful FQHCs here locally, leading behavioral health in that organization, and also spent some time in the United States Senate under the Carnahan administration in Health and Human Services. So my professional experiences as well as my lived experience has really cultivated a fire in me for health equity and health justice. And I know that I share that with so many of you. I want to thank our team for their work in planning a very engaging and informative conference for you today. So many thanks to Jason, Adriana, Corey, our grants administration, and our learning and evaluation teams for their commitment to supporting your understanding of this 2021 funding opportunity and their overall commitment to our mission. Healthy people in healthy communities is our vision. And as you know, this cannot be achieved if we do not address health equity in our policies, in our systems, and in the environments that promote health, well-being, healthy eating, and active living. It has been a challenging year, to say the least, for all of us. We have grappled with our dual pandemics of the COVID-19 virus and a more insidious and historical pandemic of structural inequities and racism. The time we're living in really requires us to adapt like never before and to be more intentional and solution focused than we ever have been before. In saying that, we know that access to nutritious and affordable foods and access to safe places and where you can be physically active and vital are more important than they ever have been before. And as you know, if you paid attention or tuned in to our 15th anniversary, Health Forward will move upstream to explore the various paths at the nexus of health, economic well-being, and race equity. We know that the shared experience of our target population is poverty. And we know that a few things undergird poverty, and that is structural racism and income and wealth inequality. And so we want to be more intentional in use of our assets, our thought leadership, our advocacy, and our resources in addressing that in partnership with you. You probably heard me say at our 15th anniversary that we would spend all of 2021 in purpose alignment, which is what I call strategic planning. We will kick that process off sometime around the February timeframe, and we really look forward to engaging and having listening sessions with you and many other stakeholders in our community to inform our strategy. We know that you are closer to the problems than we are, and that you are driving best practices, promising practices, evolving practices, and that you are close to the solution. So we commit to having a process in our strategic planning that develops our strategy with you and not for you. So we appreciate your commitment to our community, those that you serve. We appreciate your partnership, and we look forward to evolving as an organization towards greater impact with you. I want to thank you for your attention today. Again, I want to thank our team for their work in preparing this time with you, and I look forward to hearing from you as we go through our purpose alignment process in 2021. Be well, happy holidays, happy Hanukkah, happy Kwanzaa, Merry Christmas.
Thank you. Thank you so much, Kiana. Good morning. My name's Adriana Piscina, and I'm a Senior Program Officer with the Healthy Communities team. And welcome to our 2021 Pre-Proposal Conference. It's so great to see so many full faces this morning. We have a record here. We broke a record. Usually we have somewhere between 130 to 140 people at these events. And today we're at 180, but 250 plus registered. So we'll see how it goes. I'm sure, please bear with us and give us grace if some things don't work out the way we had planned. But our hope is that this is an engaging opportunity for those of you that are current grantees or are engaged in this work that we call Healthy Communities, could share some of your experiences, and particularly during this past 6-7 months that we've gone through this pandemic. So the agenda for today, as you see on your screen, we just heard the welcome from our CEO, Kiana Thomason. I will go over the what the Health Forward Foundation's mission and vision is. The Healthy Communities RFP overview will be also provided by Jason and myself, the Healthy Communities team. Our esteemed colleague, Jane Mosley, who's with the Evaluation and Learning team, will go over some brief, and we won't get too heavily into it, but go over our theory of change and very small tweaks that we made for this year. And our colleagues from our grants administration will go through the application process and the portal and how that will work if you're new to the foundation and any changes that have come up. We will have time for Q&A. We ask you to feel free to ask questions through the chat or also write down your questions and we can have some time later in the agenda for Q&A. The last part of the agenda, this is something new. We've heard from many of you that you want to have more opportunities to engage with one another and learn from one another. So we will use the last 45 minutes or so of the agenda to break out into smaller groups and to discuss some of the strategies of this RFP. And we will have a chance to also have report out. So this is the agenda for today. Next slide, please. There are some Zoom tips that we provided earlier as we were getting ready for the call, and there are some in your chat as well if you'd like to refer to them. Mainly, we just ask that you use your, rename yourself so that we know who you are and what organization you represent. We also would ask that you mute yourselves unless you're participating or reporting out or asking a question. Thirdly, we ask that you put it on speaker view. The Zoom, I know it's been interesting learning to navigate Zoom, but there is on the top right-hand corner a speaker view setting that you can click on. And lastly, during this presentation, we will be sharing the PowerPoint slides. And so please adjust your frame so that it's on the maximize setting. Next slide, please. This morning, we'll be hearing from the Healthy Communities team, myself and Jason Williams, and Karen Guile and Corey Stites, who are with our grants administration and our program associate, and Jane Mosley with our Evaluation and Learning team. Next slide, please. So the Health Forward Foundation, as you heard, we just celebrated 15 years of our existence. So we're fairly new. But our mission and vision has always remained the same. Our mission is to eliminate barriers and to promote quality health for the uninsured and underserved. Our vision, as Kiana referred to earlier is healthy people in healthy communities. Next slide, please. Our service area, these are the 6 counties in which we serve, are listed here. In Missouri, we serve 3 counties, that is Jackson County, Lafayette, and Cass, and Greater Kansas City, the portions that are in Clay and Platte that are considered Kansas City. On the Kansas side, we serve Wyandotte County, Johnson County, and Allen County. And there is a real mix of urban and rural communities that we serve. Next slide, please. So the Health Forward Foundation has opportunities for funding in 3 different ways. Today, we kick off the 2021 Healthy Communities Foundation Defined Grant, which is the same thing as an RFP, request for proposal. And we also have later after the Healthy Communities deadlines, there is a Mental Health Foundation Defined Grant opportunity that you will hear about later. And we also have a Safety Net RFP, Foundation Defined Grant opportunity. Each of those rounds are available once per calendar year. And there are dollars that range from 3.6 million to 4.6 million that are available for grants. The second opportunity for grants are through the applicant defined grant process. We call that the ADGs for short. And those are based upon the applicant's determination of need. It should be consistent with our mission and our vision, and it should address the target population that we care about, which is the uninsured, underserved, and underinsured in our service areas, which we mentioned earlier, the 6 counties. The applications for applicant-defined grants can be submitted once per calendar year. There are deadlines on our website. It's usually the first Wednesday of every month by noon. And those applications are on our website. We've been able to make some adjustments to address COVID-19, but please go to our website and learn more about the applicant-defined grant process. Lastly, we also have an area that we call special initiatives. And the special initiatives seek to address health gaps or systems fragmentation. We bring together key stakeholders to find solutions to complex health-related problems. Some initiatives originate internally, while others are requests from the community. So if you want to learn more about special initiatives, please go on the website or feel free to call one of the program officers. Next slide, please. So here's what we're all here for today. What do we fund in the 2021 Healthy Communities RFP? The primary goal of the Healthy Communities RFP is to support equitable opportunities for healthy eating and active living through policy, systems, and environmental changes. We're going to dive in more to what we mean when we talk about policies, systems, and environmental changes later in this agenda today. We do have available up to $3.6 million for 2021. Next slide, please. And here are the key deadlines, Jason.
Hello, my name is Jason Williams. I am a program officer with the Healthy Communities Round. I am going to walk you through some specifics of the Healthy Communities RFP, starting with the key dates. The letter of intent is due by noon on January 27th, 2021, and all of this information will be available on our website, and there will be an RFP on the website that you can download with all of this information. The full proposal is due by noon on February 24th, and the board approval for the recommended slate of proposals is on June 30th of next year. Any organization that submits a letter of intent can submit a full proposal. Okay, so I'll just kind of say that one more time. Any organization that submits a letter of intent by January 27th is eligible to submit a full proposal by February 24th. Adriana and I will review those letters of intent, and if we have specific questions about those or need clarification on any point, we may reach out. But if you submit a letter of intent, you can go ahead and submit the full proposal by February 24th. Next slide, please. Some of the key changes to the RFP from 2021. The most significant change in the 2021 RFP is the removal of tobacco use prevention as a focus area. In the past, Healthy Communities has focused on healthy eating, active living, and tobacco use prevention. This year, we are just going to center our focus on the healthy eating and active living fields. As we continue to shape and focus the Healthy Communities area, we felt it more appropriate this year to center around those two areas. Therefore, Healthy Communities will not be funding in tobacco use prevention of the 2021 RFP. You are welcome to reach out to a program officer if you have some interest in tobacco work or potential tobacco funding. You're more than welcome to reach out to one of the program officers to talk about potential funding opportunities, as Adriana alluded to earlier, such as the applicant define round. Those program officers are each on the call today. You can also find a list of those program officers on the Health Forward website. Health Forward also has a new grantee portal. So grantees will have a new user experience via the new grantee portal, and you will learn more about that from our grants administration team later in the presentation. Next slide. This is a change that we made to the RFP last year, but just wanted to put it in again for those who may not have been engaged in the conversation or did not apply for a grant last year. We removed as a required strategy multi-sector collaboration. So in the past, our required strategies were equitable engagement, mobilization for action, and multi-sector collaboration. We realized that multi-sector collaboration is happening amongst our partners. We realize the importance of multi-sector collaboration. It's just not a required strategy anymore. However, I just want to reiterate, we do recognize that multi-sector collaboration is essential. We expect teams to engage, and there are sections in the proposal now that will ask you who are some of your partners and to describe some of those partner relationships. So we are going to ask you to speak in the application about some of those collaborations and partnerships. However, it is not one of the required strategies anymore. The required strategies, or the strategies we require you to use in the RFP, are equitable engagement and mobilization for action. Next slide, please. And so now we're going to spend a second just talking about those two strategies. Again, just want to reiterate one more time, multi-sector collaboration previously was a required strategy. We know that work is happening. We've seen that that work has been happening over the last several years. That is not a required strategy. The two strategies that we do require you to use when submitting a proposal are equitable engagement and mobilization for action. I want to give you some examples on both. So starting with equitable engagement, some of what we're looking for is power sharing. How are you sharing power with community? How are you building power with community? Organizing task forces, facilitating neighborhood convenings, surveying residents to generate conversation, including community members in the decision-making process. What we want to ensure is that we are doing projects and programs and services with community and not to or for community. And so in that, we'd like to see a plan of engagement for residents in the work that's going to be done as a part of the proposal. And then the second strategy is mobilization for action. Some examples of mobilization for action: providing education, building public awareness, and organizing to take action to influence environmental or policy change. And so how do you move those residents towards the work and keep them engaged as you're moving towards the work? How do you organize those residents towards the goal of your particular proposal? And with those two strategies, you hear us talk about this in the breakout session. We really emphasize that power sharing component in engagement and mobilization. So how are you sharing power and doing with community and not for community? And so those are the two required strategies in the RFP. Jane is going to talk to us a little bit more about the theory of change and dive a little bit deeper into that policy, systems, and environmental change work. Next slide, please. And so I will Jane to go over that.
Good morning. As Jason and Adriana said, I'm going to talk a little bit about outcomes and evaluation. This is at a high level, so just to kind of set the stage. As many of you know, a couple years ago, in all of our rounds, we implemented theories of change, which you see here on the slide. And the goal with that was for us to be explicit in terms of the types of activities we wanted to fund and the types of change we hope to see from these rounds. So Jason just talked about the equitable engagement and the mobilization for action. And I'm going to talk about the short-term outcomes, the areas there in green. So you can slide, please. Forgot I didn't have control of that. So when you look here, these are the short-term outcomes that Health Forward is hoping to see out of this round. So a couple points I want to make about this slide. First, you'll see there's quite a few outcomes. We have them separated into individual outcomes, outcomes for communities and environments, and policy outcomes. We in no way expect folks to report on each of these outcomes. So the reason that there are 9 choices up there are because we recognize that we fund a variety of types of projects under this round. And we want to make sure that we have outcomes available that fit the work that you are doing. So what we don't want you to do is take the work that you're doing and try and fit it into outcomes that aren't a match. We want you to look at this slide and think about the work that you're doing and find, can you stay on that slide, please? Sorry, thanks. And find outcomes that fit your project. When you think about what outcomes fit your project, again, just kind of taking a step back, if someone were to ask you, what do you expect to have happen as a result of this grant funding? Think about it in that way, how you would explain it to somebody maybe who didn't work with you, somebody who wasn't engaged in the work that you were doing, and then look at the options that we have for the theory of change and see where you fit there. You can go ahead, Corey. Thank you. So again, one of the areas that we're looking for in outcomes is for individual outcomes. Some of you may be more focused on you expect to see change at the individual level, even though you're working across community. If so, you would look at that list and see, again, where is a fit for the work that you're doing? Next slide, please. We also have several outcomes around communities and environments. Many of you, often we see in this round, are working in the affordability and accessibility of foods or in changing physical environments. So if that's the kind of work that you're doing and that's the focus of your work, one of those might be appropriate for your outcome. Next slide, please, Corey. And then the last area that we hope to see progress in is in the policy level, right? Ultimately, we really want to see changes in organizational and local or even state policy that support active, healthy, and safe living conditions. So some of you are more focused on that space, and so that would be a place to focus in on. In the application, it will ask you to list the outcomes that you're going to focus on. So it would be helpful if you would go back to that list, and this is in the RFP, and use that language and see again where you're a fit for there. A couple things to just remember again. You are not, I feel like I need to say this again, do not expect it to work in all of those areas, okay? It's often better in an application if you can delve into a few outcomes in depth than talk about many outcomes, but not very well. So just keep that in mind as you're working through your application. And a couple other comments, just tips that we want to share about evaluation, not specific to healthy communities, but as you think about how you're going to talk about them in your proposal, think about how you're going to measure them. So when they're being reviewed, one of the questions will be, okay, let's just take accessibility of foods. If you're working in that area, what data are you collecting? How will you measure that? How will you report that back? So the more detail you can give on that, the better you are. The outcome should also be appropriate, again, for the work that you're doing. It should make sense for this is the work we're doing. This is the change we expect to see. So you should be able to work backwards across that. And we also want you to be reasonable with what you propose for your outcomes. We recognize that many of these grants are 12-month grants. So and we recognize many of these are big changes and they take a while to get to that. So maybe you talk about the progress and what you expect to see at 12 months. We recognize this is a big problem. We're attacking it in multiple ways, and these changes will take time. So just some things to think about as you're filling that out through the application. Next slide, Corey. So now we are going to turn to how to actually apply. It's Karen and Corey.
Yeah, thanks, Jane. We'll go over some general guidelines about the application process now. As Jason mentioned earlier, it is a two-step application process, as with all of our foundation-defined grants, with a letter of intent and the full proposal. The letter of intent is not competitive. We do review it, as Jason mentioned, to make sure you're a fit with the RFP or see if we have questions and want to talk to you a little more. But it's not competitive at that point. It's a placeholder. So you have a spot to submit a full proposal. It also helps us get an idea of the sorts of applications we can expect. So it's helpful for our planning as well. We recommend always that you do not create content in our online system. We will provide templates for everything you need to fill out that are Word documents. So we suggest you use those to gather your information and then transfer it over to the online system so that in case there's a glitch on our end or an issue with your internet at home. I think we've all experienced that in the past few months here at some point or another. But if that happens, you won't lose your content. You'll still have it in those Word documents. And you will be able to go to our website to download the entire application package. So all of those templates, the RFP, a video of today's information session will be online as well. But within that application packet, you'll have a narrative template, the budget template to fill out, an outcomes and indicators matrix, which is a document for you to lay out exactly what Jane was talking about before. So what are your outcomes and what are your indicators connected to those outcomes? It's a document that provides a nice snapshot overview of your evaluation plan. It's really helpful for reviewers. You'll also get our online application form. So any information that you do need to enter into that online system, like demographics and basic information about your organization, you'll get detailed instructions about that as well. And Karen Guile, who will be talking to you shortly, will show you exactly where to find all of that information on our website in a couple minutes. We do have a number of resources too that we encourage you to take advantage of to help have the strongest application possible. For organizations that are smaller and have an operating budget of under $500,000, we will provide up to 8 hours of grant writing consultant time. So that's a great opportunity to sit down with a professional and have them virtually at this point, right? But have them look at your draft, provide critical feedback and insights onto how to make your proposal better. And the following resources are available to anyone, regardless of your budget size. You are encouraged to consult with program officers. While our staff can't read your proposals, we can certainly talk to you about your ideas and help you brainstorm and make sure you're on the right track with your proposal. And we also recommend, certainly if you're new to Health Forward, we definitely recommend that you reach out and talk to someone so you're not going into the application process blind. If you have applied before, we also encourage you to get feedback on those applications. So you can reach out to us and we'll set up a virtual session to talk about the strengths and weaknesses we saw in your previous proposals. You also have the opportunity to review exemplary grants, which is, just reviewing grants that we received and funded and felt were particularly strong. And you can see there, email our grants admin team is the best way to set that up at this point. They'll ask you some questions about what you plan to apply for and try and pull examples that are most relevant to the work you're doing. And finally, we do provide fiscal agency service through a third party for those organizations that don't meet our auditing requirement. So if you are not at a stage where you have an annual audit, don't let that be a barrier. And that's not something anything you have to have worked out on the front end of an application. Just know that that's a service that's available. And I will turn it over now to Karen Guile to talk about our registration process.
Good morning, everyone. I am Karen Guile, and I'm going to spend a few minutes this morning walking you through our the technical aspects of our application process. It's really good to see your little tiny faces this morning. It's better than not seeing you at all, I'll tell you that much. So when you start your application process, you're going to want to go to our, first of all, can everybody see my screen? It should be our website, Partnering for, thank you guys. You're going to want to come to our website, healthforward.org, and you're going to want to go to grantees and applicants right here. And then you want to go to application process. And then you'll have options for whatever grant you'd like to apply for, in this case, Healthy Communities. And here is where you will normally find all the materials that Corey mentioned earlier, the templates where you can outline your whole application and get it down on paper before you transfer it into the online portal. It'll be right here under instructions and templates. There'll be a zip file here that you will click and it'll download down here, and you'll open it up and you'll see instructions folder as well as a folder with all the templates you'll need. So it's not there now because we're putting some finishing touches on them. So we invite you to look for them in the next couple of weeks. I think, Corey, in 2 weeks we said, and then so you'll be able to start at that time. For the letter of intent portion, though, you won't need any templates to upload any templates. Everything will be entered online. It's a very brief proposal. So now when you're ready to get into the portal and start your online application, you'll see there's this section here on our website called Grantee Portal, and you can access the Grantee Portal here. I also wanted to point out right here at the bottom of the page are some instructional webinars. There will be a virtual tour here we have recently refreshed our Grantee Portal to provide a more attractive user interface and enhanced functionality for you, which I'll demonstrate in just a second. And also the slides and the webinar from today will be found here at the bottom of this page. So to access the Grantee Portal, you click here, and I'm just going to cheat because I already have it open. And you'll go into login. I was looking at the participants here today, and I noticed there are a lot of names I didn't recognize, and I think there might be some people who have never applied before to Health Forward, which is excellent. I would encourage all of you, anyone who has never applied to Health Forward in the past, I think it'd be really great for you to reach out to our grants team so we can schedule a brief orientation of the application process for you, so there aren't any surprises, or you know what to do if you face a technical problem. So please reach out to our grants team at grantsadmin@healthforward.org, and you can find us on the website always. When you get to the portal, if you're a new user, you would click here and it'll take you through a series of eligibility questions, which you'll only have to answer once. And then it'll ask you to register for the portal. You enter your information, and it will send you an email to click and confirm your password. Then you're good to go. For those of you who have not applied to Health Forward, who have applied in the past, you know you have a login, but you have not applied in the last 6 weeks, I want to let you know that all usernames have been converted to your email on file with us. And if you don't, and the passwords remain the same, but if you don't remember them, go ahead and click forgot your password, and I'll send you one. Any questions you have, just let us know, contact grants admin, and we'll be able to walk you through it. And now, once you get in, you see that we have redesigned it and it looks a lot different. And if you want to unmute right now and be like, ooh, oh, it's glorious. Like, I'll take that. It'll be good. It was a lot of work. But
it's glorious.
Thank you. Congrats. Is that you, Kiana?
Keisha.
That's probably my colleagues on the grants team, but I appreciate it. Thank you. So we worked really hard with some really excellent consultants to provide a better user face for you guys. And you'll see now, when you get to the landing page, you'll have your applications that you can access immediately, all your open applications, but also there's these 3 main buckets. And these are the open grant opportunities at the moment. And so if you have not started an application and you want to begin one, this is where you're going to go. Just wanted to point out right here is we have an account management section where you can manage not only your own information, but some of your coworkers. Like if there's new people at your team or somebody has left the organization, you can update that information there, as well as, for those who've been applying for a year, we ask for audits, 990s, IRS letter determination with like every application. Now we only ask you to upload it once per year, and it'll be in this section. And then we'll provide you with some resources and FAQs in this section. And we'll have all our grant deadlines will be here for to help remind you. And hopefully those will be there on Monday because they just got approved by the board this week. So to start your Healthy Communities LOI, you would go to Grant Opportunities, apply now. And you would see the open opportunities we have at the moment. You'll click Healthy Communities, Letter of Intent. And there'll be some information about it. You're ready to start, you start a new one. And I just wanted to show you that it's really user-friendly and it's not very difficult, but I wanted to demonstrate it today because it does look a lot different. And you'll notice how it stops and spins for a second. And it's just downloading. In order to make it a lot more attractive for you, the con is that it takes a little more time, so that it's downloading information from the application and also pulling information that you might have already entered. And so it'll pre-populate here. So the application now, it used to be tabs all along the top, and now it's just a menu where you can start sections and walk through. Takes a second. And so you'll just start answering your questions, save and next. And so that's it updating for you. And you just go through that way. And I just wanted to show you because it does look a lot different than it did before. And if you guys have any questions or any problems, please let us know. And, never spend more than just 5 minutes trying to struggle through something. Just always contact us because hopefully we can save you a bunch of time. Team, did I forget anything? Sounds good. Are there any questions in the chat, Corey? I'm sorry, I haven't been looking.
There's a lot of compliments about how great it
Even
looks.
better.
So,
Thank you.
I'm not
All right,
seeing any
that's
specific questions yet, but if any more come through, we'll address them in Q&A for sure. All right. Let me get back to our PowerPoint here. There we go. All right, as Karen mentioned, we do expect our full proposal materials to be online mid-December, so in a couple of weeks here. And once you go through all the hard work of submitting that proposal, we wanted to share about the review process. We do review with internal and external reviewers. And then based on the feedback we get, we will perform some due diligence. So we'll reach out with any questions that are important for us to know before making a determination on what grants to award. And finally, the slate of recommended proposals goes to our board for final approval. And at that point, then our awards are announced publicly. And we did want to clarify a little bit about our process, since we have gotten questions over the years from the community about the role of external reviewers in particular. So Health Forward consults with external reviewers for their expertise and their unbiased feedback. As a reminder, they are from outside of our community, so make sure you do a good job explaining your place in the community and what you're doing and your history, because they won't know that. We also rely on our internal knowledge. The folks we have on staff have great knowledge of the field, the community, and of course our history with applicants and grantee track record of grants with us. So we take that into account as well. And ultimately, decision-making lies with the Health Forward staff and leadership, with the guidance and final approval of the board of directors. And with that, we will open it up for Q&A. And I know some questions came through in chat as well, so we will get to those too.
Corey, I'm just going to address a couple of the ones that have come in under the chat in regards to my section in the application process in the portal. One question was, Roxanne asked if all your historical applications will be listed in the portal when you log in. Yes, it will have all historical information, though if the application was submitted prior to 2019, I'll probably just give you a brief snapshot of what you submitted, like the abstract and how much was requested, if it was awarded or not. You wouldn't have access to the files or anything, but you can contact grants administration and we can provide that to you. Catherine asked if you'll be able to download a copy of what was submitted. We're not able to provide a print feature in this portal. However, when you submit an application, when you get an acknowledgement back, attached to that acknowledgement will be a snapshot of all the content you entered. And I believe it even includes files, but I'll have to double check on that. And Kiana Baldwin, if you know, pop in here and let me know if it does include files.
It does not include
okay.
the files. Yep.
Okay. So it doesn't include the files, but you can go back to your application and see the files you attached. There was one more that I missed, Jessica. Jessica said, can you save and return to your proposal when going through the application? Absolutely. So you would, you start your application, you save it, and then it will appear on that homepage on the My Applications. So that's where all your open applications will be. You have to go to open or start a new application to start one. But then once you've began and saved, it'll be in your My Application list. Dan, Ryan, there is a way to download the entire application before submitting it. Corey has put together an excellent online template. So she took everything we ask on the online application and put it into Word for you. And it's available in that zip drive on our website. And Lee, yes, there will be a template for the LOI the same way as I just mentioned for Dan. Okay, some of these other ones are more unique, so I might just respond to the person directly. Okay, thanks.
This is Diane Cleaver. May I ask a question?
Go ahead.
I raised my hand, but I don't know if you saw it. We had heard at one point that Health Forward was going to do a round around policy advocacy. Is that correct, or would that type of work need to just be included or submitted in the Healthy Communities round?
Health Forward does have, has had for the past 2 years, a policy and advocacy round. It wasn't open in 2020. It was continuations for those projects that were approved in 2019. So we are making decisions about how that will function going forward, but we are still happy to receive policy related initiatives within each of the FDG rounds if they are related to that FDG round. Does that answer your question, Diane?
I'm sorry, so were you saying you may have that round this year? Or I'm not clear.
And if I will let that question be fielded by our leadership, if they're available to answer here.
Jump in.
I'm glad to, this is Graciela Diane. I don't know if you can see me or hear me. So we had what we called our PCE grants that were policy grants that were a 2-year grant. The second year was kind of contingent on the first year. So those started last year, and this is the second year of those grants. So those are not going to be available this year. We are already committed to a cohort of grantees. But you can always apply for any policy related projects, either if they match, they fit within healthy communities, or you can come to us as an applicant to find grant for any policy or advocacy project. So the PCE grants are already committed this year. We will probably have them again. And yes, it's the policy and civic engagement grants. Those are the cohort that we have 2-year commitment. They will be available again in 2022. We are considering having another round in 2022. That's not a final decision yet.
Thank you.
I think I saw a question about equity. And for us, equity is not new to this round. We've always used language that is very much addressing the equity lens, ensuring that we meet people where they are, that they, I think there's a visual that's in the RFP that we've been using for some time now. I think, Corey, if you put yourself on the virtual screen, I think that's the visual, but mainly, to explain that, equity is really meeting people where they are. We know that solutions to problems lie in those that are closer to the problems, right? So it's not a one size fits all, right? We have to really listen to the people that are most impacted and engage them in building solutions. I'm not sure if any of my colleagues would like to add to the equity question.
I will.
Go ahead.
Corey, if you were gonna go through the chat questions, that's just what I was gonna do. So,
Oh, go ahead.
okay. The first question was from Kathy. What are some thoughts about engaging community members during the pandemic? Kathy, you read our mind. That is one of the questions that we are posing in our breakout rooms. We learned in a convening a couple of years ago that grantees benefited and learned quite a bit from engaging in conversation with one another. So while we recognize that equitable engagement may be more challenging given the pandemic and the virtual space we all have to work in, we are looking to learn from one another and other grantees who already have a proposal or others who are already doing the work around how they're continuing to engage residents in an equitable way towards policy systems or environmental change in the healthy eating, active living space, whether or not that's virtual town hall meetings, or virtual sessions or whatever that looks like. Part of what we're going to talk about in our breakout sessions is that engagement in the midst of a pandemic. But as we read the full proposals, we do realize that engagement will look different this year and may look very different based on the capacity of those organizations and having to move virtual. And we do ask organizations to speak to some of that in the proposal. Lisa had a question about COVID-related access to healthy foods for an aging population. That would be an appropriate ask in this round. We do recognize that access to healthy foods has become challenging, specifically for aging populations. We've seen some of those proposals come through our applicant defined round. And so in the healthy communities round, access to healthy foods and equitable access to those healthy foods, specifically some of those high-risk populations given the pandemic, would be an appropriate ask in this funding round.
We got a question from Dorothy Barnett about, is there a place on your website that shows what kind of grants you've funded in the past? And there definitely is. If you go to our website, and on the right side, there'll be a sidebar in the About Us section, what we fund. If you click on that, there will be another option to select on funded grants. So then you can walk through like the different funding rounds and see what we've funded recently and click on each one to learn more about it. Kelly Carpenter asked if we would like to review some exemplary grant proposals. Who's the best person to reach out to? And you're certainly welcome. The best way right now is to email grantsadmin@healthforward.org. That goes to several people on our grants admin team who can coordinate that with you. And you're also welcome to reach out to Adriana and Jason about if they have specific ideas. Often the grants admin team will consult internally to see what are the best proposals to review.
I'd like to address one question from Tisha Miller with Youth Ambassadors. You asked, I'm curious if mental health projects are welcome in healthy communities. And yes, they are. We know that it takes multi-sector collaboration to do this work. And we have seen in the last 3 years an increase of mental health providers that are engaged in this space of healthy eating, active living, and finding safe places for people to be physically active. So yes, you can, and there are some examples on the website of those grants that we have funded in the last 3-4 years.
If a grantee has a 2-year policy grant, may it still apply for the Healthy Communities round? Yes, you can still apply for a Healthy Communities proposal if you hold a policy and civic engagement. Yes. I am searching for additional questions.
Sorry, I don't think we've addressed this yet. Linda Keaton, can you talk more about economic well-being and how it fits in the strategies for this round of funding? And I would let my colleagues address that one.
I think this is a similar question to the mental health, also looking through that lens of multi-sector collaboration. There are many organizations that provide wraparound services, a lot of different services, not just specific to healthy eating or active living, but they're also addressing the whole person. So, ensuring that they have all the important things that are needed to thrive in this community. So housing are some organizations that we have funded, that are addressing homelessness. There's some that are also working with individuals that are trying to improve their work experiences and training and skills so that they can have jobs that are going to help them survive and their children thrive. So we have more organizations that are starting to apply for grants in healthy communities. And we know that there are many reasons why people are in communities that are not healthy, that are not addressing their well-being. So I'm not sure if any of my colleagues, Jason or Graciela, would like to add.
I think you did a good job, Adriana.
We got a question about any advice for a first-time applicant. And I would say that's from Jessica Hoffman. And I would encourage you to take advantage of all of those resources we talked about. So review some exemplary proposals, have a conversation with Jason or Adriana, really, and think about if you're eligible for that grant writing consultation, reach out to us sooner than later if you're interested in that. Yeah, take advantage of all of those. And if anyone else has advice, feel free to chime in.
Just chatted it. My advice.
Yeah.
Thanks, guys.
And everyone, if we have missed your question in the chat was kind of exploding there for a while. It's hard to keep up with. So if
It is
we missed
hard.
it, please just unmute and feel free to ask us or chat us directly. So
There is a question from Janet Baker, just following up on the 15-year anniversary report from Kiana to increase emphasis on the three-legged stool of health, economic, and racial equity. Is there a different level of expectation in healthy communities related to the application process? Can you explain strategic objectives and desired outcomes for Health Forward in these areas? So for the 2021 RFP, specifically related to the 2021 RFP, the Healthy Communities Round expects that the equity component takes place in that equitable engagement strategy. So the equitable engagement strategy requires that residents that are going to be impacted are engaged in an equitable way. And that's how we require that equity component for the 2021 RFP. As Kiana mentioned in the chat, we are going through a purpose alignment process. And so that may look very different in the future, but for the 2020 RFP, we speak directly to that equity component and how we engage residents in the conversation around programs, policies, systems, and environmental change. And so that would be the expectation for the Healthy Communities Round in terms of equity, the intersection of equity and engagement.
Thanks, Jason. I saw a question here from Linda Keaton. I think it's, can you submit applications in more than one of the FDGs? Good question. No, you can only submit one application in the FDG rounds. Unless you are a large institution, universities, hospitals, you can submit up to two.
But you can, if you have programs related to both healthy communities and mental health and or safety net, you can submit a proposal in each of those rounds. And I got a question about if we would like to talk with a program officer to discuss proposal ideas. Do we just contact them directly? And I would say yes, and email is probably the best way to get in touch right now. So just email Adriana or Jason to set that up.
I will just note that we would be more than happy to brainstorm with you and your ideas. And the only thing we cannot do is read your proposal draft. We can't do that. That's been a request, but we cannot since we are part of the review process.
And I just wanted to read Karen Giles' advice to first-time applicants that you should reach out also to our grants admin team just for a really brief orientation. They'll walk you kind of through a little more of the detail of our process. Since if you're not familiar with our foundation, we just want to make that as easy for you as possible. So feel free to take her up on that as well.